But anyway, I think we'll begin. So once again, I'd like to welcome all participants in our meeting this afternoon, or morning or night, wherever you may be, which has been called by the Socialist Equality Group in New Zealand. My name is Cheryl Crisp. I'm the National Secretary of the SEP, and I'll be chairing today's meeting. And the meeting itself is entitled No Retreat from Elimination, Mobilise the New Zealand and International Working Class to Defeat COVID-19. There will be 3 speakers who will deliver reports. We will then open up for any questions or comments which we can answer and discuss. I will call for a collection for our party funds, and then we'll conclude with some announcements. So in introducing this meeting, it may appear somewhat curious that in a country of 5 million people, the size of Sydney, the announcement of that country's Prime Minister, Jacinda Ardern, that the government was discarding the policy with which it had been so closely associated, that of the elimination of COVID-19, would attract so much attention, not just in the pages of the New Zealand or the Australian media, but that of the New York Times, the Washington Post, and others. As the saying goes, context is everything. And the context in which the New Zealand Prime Minister, Ardern, made her willfully unclear statement was very significant. And that context is that today, internationally, cases are at almost 244 million people infected, with deaths now about to reach the grim milestone of 5 million dead. Since October the 4th, less than 3 weeks ago, when Ardern actually made her announcement, over 7 million people have been infected, and more than 117,000 have died worldwide. So far from the pandemic being behind us or over, it is far from that. It is still spreading, and that rate is increasing. Notwithstanding vaccinations, which themselves were the result of an international collaboration between scientists and medical experts on a world scale, the situation confronting the global population is one of enormous danger. This has not resulted because of the viral characteristics of COVID-19, but because of the policies of capitalist governments which have created the conditions for the virus to mutate, which has enabled its spread. Again, this is not because mankind does not have the knowledge, notwithstanding the novel character of COVID, but it's not as if the world does not have the knowledge of the measures needed to combat, control, and defeat coronaviruses. But the different medical approaches to the virus and to dealing with it are bound up not so much with science, but with economics and finance. 3 strategies have emerged: herd immunity, mitigation, and elimination. And I'll just go through them briefly. Herd immunity, which is most associated with Boris Johnson in the United Kingdom, opposes any public health measures such as lockdowns, school closures, masking, purporting that the virus should be allowed to spread, particularly amongst the younger population, which will, the theory goes, create immunity to protect the more vulnerable in the population. It is an entirely bogus and blood-curdling means of ensuring factories, shops and businesses remain open no matter what the cost in human life. The policy of the cure can't be worse than the disease, first enunciated by Thomas Friedman of the New York Times, was embraced by Donald Trump and has cost the lives of more than 725,000 in that country alone. It is, of course, associated with Bolsonaro in Brazil, Modi in India, and of course, Boris Johnson in the United Kingdom and Sweden. Mitigation, which is a policy that vaccinations alone with various and limited measures such as masking can stop the spread of the virus. This is actually an attempt to straddle the interests of corporations and business with the task of lessening the impact of the virus. The Biden administration in the US has presented this falsely as the means of overcoming the pandemic, and nothing could be further from the truth. The Delta variant, only the latest and the most virulent form of COVID-19, is too transmissible for vaccines alone to be effective. In fact, another variant of Delta has been detected in the United Kingdom only recently. Scientists warned that this policy cannot defeat the virus, and experience has confirmed that warning. But nevertheless, the schools have reopened, the workplaces functioning at full throttle, and predictably infections and deaths rise. The mantra of this policy is that the population has to learn to live with the virus. And then there is elimination, which is the strategy of ending the transmission of the virus by the combined use of vaccinations and public health measures, including strict lockdowns, the closure of schools temporarily, of non-essential industry, social distancing, mask wearing, testing, tracing, isolating, and quarantining. The combination of these measures has in fact been proven to be highly effective and successful. It is based on science and in the interests of the mass of the world's population. These issues will be discussed in detail at the October 24, or for us, the October 25 online forum being conducted by the World Socialist website entitled How to End the Pandemic. I would urge everyone who's in attendance this afternoon to also attend that meeting. It will feature a panel of highly experienced and distinguished scientists and medical experts, along with workers who are leading the opposition to the policy of the governments. These medical experts and scientists have, since the outset of the pandemic, fought for a position and program of elimination. But the impact on production, profit, and the accumulation of wealth is a price that capitalism will not pay for the program of elimination. 18 months from the first outbreak, the demand of Wall Street, corporations, and major businesses is that there will be no more lockdowns. The pandemic is behind us. There will be no impediment on production or the accumulation of wealth. And predictably and lawfully, as the death toll rises from COVID-19, so too does the wealth of the richest billionaires in the world. The Forbes report has just reported that the wealth of US billionaires alone has increased by a massive $2.1 trillion, or 70%, since the onset of the coronavirus pandemic in March of 2020. In the same time, almost 750,000 Americans have died of COVID. Tens of millions of working people have faced unemployment and poverty. And additionally, the list of American billionaires not just has grown in their wealth, but in their number, from 614 to 745 billionaires during the same period. The Northern Hemisphere has witnessed the forced reopening of schools, with millions of unvaccinated children being herded into classrooms without masks, ventilators, or social distancing. The predictable and inevitable result is the mass infection of tens of thousands of children and teenagers, their growing illnesses, and the death of some. Teachers, parents, grandparents, carers, childcare workers, and the children themselves are horrified, fearful, and opposed to the wanton malice with which Boris Johnson, his government, and other governments have enacted and enforced this policy. The same program, the same policy is now underway in Australia, which Patrick O'Connor, who will be speaking as one of the presenters, will outline. And it's also taking place in New Zealand, which Tom Peters will also speak on. So why would governments impose a policy of such brutal disregard for the lives and well-being of the most vulnerable layers of the population? The herding back of children into infectious classrooms has nothing to do with their education or their mental health, but everything to do with forcing their parents back into factories and workplaces. The ICFI has characterised the pandemic as a trigger event, analogous to that of World War I. In that war, the war to end all wars, which began in August in 1914, as young men marched off in uniform, they thought that they would be home for Christmas. But the war dragged on year after year, with the death toll rising to unimaginable and unheard of levels. Were it not for the mass movement of opposition which developed in the working class throughout Europe, most consciously and profoundly expressed in the Russian Revolution of 1917, it would have gone on longer than the interminable 4 years it did, because that was in the interests of the capitalist class. Today, estimates which were developed by The Economist magazine based on reports of excess deaths are that more than 15 million people have in fact died, not the 5 million officially put forward, and that they have died since January of 2020. So you have now a comparable death toll in 2 years from the pandemic that took place in World War I over four years of bloody slaughter. The task which confronted the European and world working class in 1914-18 faces the working class today. Without the independent intervention and action of the working class, the pandemic will proceed unchecked, with the associated deaths and illnesses of millions of people. The upsurge of mass struggles against the policies of governments, particularly expressed in the school strikes led by UK parent Lisa Diaz in the United Kingdom against the reopening of schools, is a sharp expression. There are others where workers are overwhelmingly rejecting the union company contracts and offers and fought for strike action in direct opposition to the perspective and the role of the trade unions. This will and is taking place on a broader scale internationally. But what is required is a perspective, is a political perspective to guide this opposition. What the working class requires is a party, is a leadership, and a leadership which fights to unify the international working class, a leadership which fights for science, for historical truth, and a socialist perspective which can animate and develop these struggles and fight for the only means by which mankind will be able to work its way out of this pandemic, and that is through the fight for the overthrow of capitalism and for a socialist perspective. And so it is for this purpose, for this reason, that we hold this meeting today. Our first speaker, and I'm very pleased to be able to introduce him, speaks from the United Kingdom. Our guest speaker is Harvey Thompson. He has been a member of the SEP for 30 years, and he's an educator in the United Kingdom. He's speaking from Sheffield in Northern England at the uncivilised and gruesome hour of 4:30 in the morning. And so we are really very grateful that he has been able to speak to us this morning, his time, and present some of the experiences that have taken place in the United Kingdom. So with that, I'd very much like to welcome Comrade Harvey for him to speak to you today. Okay, Harvey, you can unmute and speak.
Okay, thank you, Cheryl. Hello, everyone. I am honoured to be speaking to a like-minded audience in New Zealand, but it's with great sadness, I have to say, and anger that I have to bring you greetings from one of the COVID-19 capitals of the world. On Wednesday, Brazil's President Jair Bolsonaro was charged with crimes against humanity for presiding over the deaths of 600,000 Brazilians from coronavirus. The charge sheet by the country's Senate Commission of Inquiry is long. It includes, in summary, working for the spread of the virus, violation of healthcare guidance, quackery, incitement of crimes, forging of documents, and crimes of mismanagement and omission. His crimes against humanity include extermination and mass murder of Brazilians. These charges stand as an indictment not just of Bolsonaro, but of capitalist heads of state the world over, and none more so than British Prime Minister Boris Johnson. Johnson was the first world leader to publicly declare the policy of herd immunity, telling the British people in March 2020 they should take the deadly virus on the chin. As the second wave of the pandemic took hold last November, he rejected any further lockdown measures, declaring, "Let the bodies pile high in their thousands." 10,000 people have died across Britain since so-called Freedom Day on July the 19th, when the government lifted all remaining mitigation measures. The UK's death toll has since reached 162,620 officially. The gleeful declarations of Freedom Day expressed the bloodlust of a financial and corporate elite who insist nothing must get in the way of their divine right to keep profits flowing while gutting public health and killing untold millions. Events this week in Britain have shocked people. Despite the vaccine rollout and a furious media campaign proclaiming that the pandemic is actually over, the virus is again surging. There were more than 300,000 new cases this past week, a 20% increase. Hospitalizations and deaths are also rising. 868 people each day were taken to hospital last week, and the National Health Service is on the brink of collapse. A few days ago, a doctor tweeted a photo of ambulances lined up outside her hospital. She explained, quote, "These 25 ambulances are unable to attend 999 calls because the hospital is full, so they sit trapped outside. Their sick patients unable even to enter the emergency department. Boris Johnson, your refusal to confront this real, unfolding, deadly crisis is unforgivable." Thousands of similar tweets and messages could be cited. Over the past week, 908 people have died from COVID-19 in Britain, 15% increase in just 7 days. Yet on Wednesday night, the Health Secretary, Sajid Javid, told a press conference that even though 100,000 cases a day were likely in the weeks ahead, no further measures will be taken to stop the pandemic. As one NHS worker tweeted, quote, "This is the health secretary of a country saying you have to live with it," end of quote. Earlier this month, New Zealand epidemiologist Professor John Potter responded to the Ardern government's decision to end the policy of elimination and warned, quote, "If COVID-19 becomes endemic, every year many of us will know someone who dies," end of quote. This is already the situation in Britain. Virtually everyone here knows someone who has been killed by the virus. Jacinda Ardern reportedly phoned the families of all 28 people in New Zealand who had died from COVID. Someone on Twitter recently worked out that, quote, "If Johnson did the same, with each call taking 5 minutes, it would take him 5 years 9 months and 2 weeks. The level of death is equivalent to a major war and has killed 3 times as many people as during the Blitz of World War II. The decision of the Ardern government to end its previous COVID elimination policy is criminal. It is a death sentence for unknown numbers of New Zealanders. But its significance goes well beyond even the borders of New Zealand. For millions of people, New Zealand was regarded as proof that it was possible to eliminate the virus. Ardern's declaration that the country must, quote, transition to a new way of doing things, end of quote, confirms a shift by the ruling class internationally. It is the outcome of demands by corporate and financial interests and the world's most powerful imperialist countries that Ardern's Labour government is more than willing to accommodate. Ardern's policy reversal was met with gleeful headlines from Britain's Telegraph newspaper. Here are some of them. Poor Jacinda Ardern, trapped in her arrogant zero COVID policy. Jacinda Ardern has come crashing back to earth. Jacinda Ardern admits defeat over zero COVID policy, as she says Delta variant hard to shake. And from Rupert Murdoch's Times, New Zealand abandons absurd zero COVID strategy. The events in New Zealand prove the eradication of COVID-19 is not just a medical fight, but a political struggle too. This is because the defense of science and public health comes up against capitalism. Only a powerful social force can oppose the reckless policies of Johnson, Bolsonaro, Biden, and Ardern, and support the noble efforts of scientists, epidemiologists, and other public health experts to beat the pandemic. Britain is bearing witness to growing opposition to the capitalist policy of herd immunity and social murder. Millions of working people are drawing lessons from their experiences and want to fight. The global school strikes called by UK parent Lisa Diaz this month are a symptom of this desire and have resonated globally. She has given voice to the real sentiments of the working class throughout the world. In a video posted by Lisa on Thursday night, she outlined the catastrophic situation in the schools, describing it as mind-blowing. Here are some statistics. In one in 33 primary school age children have COVID. In secondary schools, 1 in 12 has the virus. At least 12 school children have died from COVID since schools went back in September. That's less than 2 months. Extraordinarily, parents who keep their kids off school to protect them from COVID are being threatened with massive fines, jail terms, and even having their children removed from their care. As Lisa Diaz insisted, quote, we have to resist, end of quote. Sending kids into unsafe schools with zero mitigations in place is the major factor behind a new wave of infections, spreading now to older age groups and leading to increased hospitalizations and deaths. All of this is backed by the Labour Party and the trade unions, the teaching unions. It was Labour leader Sir Keir Starmer who declared that all kids should be back in school, quote, no ifs, no buts, end of quote. While Jeremy Corbyn and his fellow, inverted commas, left MPs have kept their mouths shut. The teaching unions have openly attacked calls for action. National Education Union leader Kevin McCartney took to social media this month, castigating teachers and parents who were calling for strike action to save lives. Diaz's initiative in calling the global school strikes was influenced and supported by the work of the educators' rank and file committees and the World Socialist website. Her actions recognize a basic truth. If there is to be a fight to save lives, champion science, and eradicate the pandemic, it must be led by the working class. The establishment of the International Workers' Alliance of rank and file committees on May Day of this year was a statement of intent. Its aim is to develop a global counter-offensive by the working class against the homicidal policies of capitalist governments, which are responsible for the worldwide catastrophe that is the pandemic. I heartily congratulate the Socialist Equality Group in New Zealand for holding today's meeting, and I urge everyone listening to attend tomorrow's international webinar, organised by the World Socialist website, How to End the Pandemic, to discuss how to take forward this critical fight for the defence of science and the lives of the working class all over the world. Thank you.
Thanks very much, Harvey. Look, I'm sure there will be numbers of questions from the audience about the situation in the UK, and I'm sure about the situation in New Zealand. And those remarks, I think, have certainly created plenty of food for those questions. Our second speaker is Patrick O'Connor. Patrick is also a teacher. He teaches in the primary school system in Melbourne, Victoria, and he's a member of the Committee for Public Education. Patrick has been a member of the SEP in Australia since 2003. He writes for the World Socialist website on the situation in Australia, the Pacific. He has written historical articles and articles on education and, in many cases, the history of education. And he will be speaking about the conditions certainly in Victoria, but also Australia. And we're very pleased that he could attend and speak today. Welcome, Patrick.
Thanks, Cheryl. The tech team might be able to help me start my video. There we go. Thank you. Thanks very much, everybody, and to Cheryl and to the Socialist Equality Group in New Zealand for organising this important meeting. I'm very pleased to be able to speak specifically on behalf of the Committee for Public Education, the CFPE, here in Australia. What's unfolding in the schools here now represents an entirely avoidable and preventable disaster. And it's a disaster for which the entire political and media establishment in this country is responsible for. However, the Labor Party and the teacher unions have played an especially crucial and frankly criminal role. I'd just like to review briefly some of the history that's led up to the reopening of the schools here amidst the record infections throughout the course of the pandemic. Unlike New Zealand, the ruling class in Australia never committed to an elimination strategy with regard to the COVID crisis. At the beginning of the pandemic in early 2020, the federal Liberal National Government of Prime Minister Scott Morrison met with his state counterparts, state and territory counterparts, both Labor and Liberal, and discussed a so-called suppression strategy, explicitly considering and then rejecting an elimination strategy. And the rationale was very transparent, very open. You can see here Scott Morrison, I've just got the quote from his press conference in April 16. We're not in eradication mode, nor are we in the other mode, which would just see some sort of herd immunity approach. Now that was Morrison attempting to differentiate himself or distance himself somewhat from the line pursued by Donald Trump and Boris Johnson in Britain, amidst widespread opposition within the working class here in Australia to such an approach. Scott Morrison didn't feel confident openly embracing a herd immunity approach, but the effect was similar. You see the journalists replying, why is Australia not trying to eradicate the virus given our progress has been so strong? And it's worth recalling in April 16, 2020, so I don't have the figures exactly on hand, but the number of infections in Australia was extremely low. I think it was approximately 150 cases total in the entire country. And even given that, elimination was rejected. Why? Well, Morrison says, quote, the eradication pathway involves an approach which would see even more economic restrictions than are currently in place. And that is not seen to be a wise, in our view, trade-off on how we're managing the two crises that we're facing. The economic one and of course the health one. Now we're doing well on the health one, I want to do better on the economic one. And you can see in the bottom, the top photograph there is of the National Cabinet, so-called, this unconstitutional body bringing together the Labor and Liberal parties through the state and federal and territory governments. The bottom picture there shows the slide that Morrison presented on April 16. He had a couple of slides about the need to suppress the virus, prevent, flatten the curve, prevent the hospitals from being overrun, but he had nearly an equal number of slides about the economy. You can see one there in the background about his priority concern, which was maintaining business activity, maintaining profit accumulation. Now, Morrison's statements went unchallenged by any figure within the political establishment. Every Labor leader was on board with such an approach throughout the year. And this approach then laid the basis for the entire national health policy. I mean, Morrison's remarks later in 2020 about denouncing Australian people for wanting to cower under the doona in the face of the COVID situation, his refusal to invest the necessary resources to construct proper quarantine facilities in order to safely house returning citizens and other visitors to Australia amidst the pandemic. It all flowed from this conclusion that it was necessary to so-called, supposedly live with the virus. Now, as I raised before, there were immense pressures that emerged within the working class very immediately. There was a significant strike of a group of warehouse workers in Melbourne who had been exposed to the virus. There was widespread discussions amongst teachers and school staff about taking action to protect their safety, including industrial action. Similar discussions were unfolding amidst health industry workers, construction workers. And that fear was very palpable within the ruling class, and that's what triggered the initial lockdown measures. And even though it wasn't official policy, the lockdowns repeatedly resulted in elimination. This was an outcome due to the diligent work of public health officials, but also, importantly, the determination of ordinary working class people to take the necessary measures in order to avoid the development of a situation here that could be comparable to what was seen in New York City and Northern Italy in early 2020. Lockdowns of varied durations, in fact, eliminated the virus numerous times in Australia, 5 times in Melbourne alone, and elsewhere at least once in every state and territory over the course of the pandemic. And this elimination included responses to outbreaks of more infectious Alpha and Delta variants of the virus. In other words, this record directly belies the claim that's now being promoted that elimination is somehow unfeasible, if not outright impossible, if not outright utopian and unwarranted within this situation. Despite the repeated elimination of the virus, there was a developing campaign that reached a crescendo midway through this year from key sections of the corporate elite, the financial elite, through their mouthpieces in the corporate media, expressing their determination to eliminate lockdowns, eliminate all other restrictions that hindered their activities, hindered the accumulation of profits. And this campaign found a very direct response, initially through the New South Wales state Liberal National Government, as I'm sure is familiar to most, if not all of us. In mid-June, there was a single positive COVID case detected very early on from a Bondi resident who had been working as a chauffeur for international flight crews. And again, indicative of the lack of proper safety restrictions, the chauffeur was not vaccinated, didn't have proper personal protective equipment while he was driving around international flight crews. He got infected. In response to that, the state government of then Premier Gladys Berejiklian did literally nothing for 11 days. They just watched as the infection spread from one case through the suburb of Bondi and then into the western working class suburbs of Sydney. It's now known that even after the first super spreader event in this cluster of cases, that is a house party in the suburb of West Hoxton that triggered dozens of infections. Even 2 days after this was known to the authorities, the government refused to take any action. And that amounted to a conscious sabotage aimed at getting rid of what had previously been a zero COVID situation in Australia. The New South Wales government was working on behalf of the corporate elite. It knew that it was impossible to persuade the population to learn to live with the virus. That was not a possibility. Therefore, they worked to to manufacture a fait accompli, that is mass infection, which is what's now unfolding. However, it is important to emphasise, after reviewing the record of the New South Wales government, that it is now Labor governments, state Labor governments across the country, that are playing the critical role, the central role in promoting this line of living with the virus, promoting this record of supposedly tolerating and accommodating mass COVID infection. The Queensland State Labor government just the other day announced its reopening date just before, mid-December. They are going to open up the state borders, even though there's a zero COVID situation in Queensland. They are consciously importing the virus, and they've warned everybody to brace themselves for mass infections in that state. Here where I am in Victoria, the state Labor government has officially ended lockdown restrictions this week in Melbourne, and at the same time declare that they will never again be imposed. Regardless of how bad the public health crisis develops, there's not going to be any return to a citywide or statewide lockdown response. You can see in the slide that's currently displayed some of the indices of the disaster that's unfolding, entirely preventable, entirely predictable disaster that's now unfolding. This is yesterday's case numbers on the left, near record, 2,159 cases recorded in 24 hours. There's now a total of 23,000, more than 23,000 active cases across the state. It's important to emphasise that these cases are not evenly distributed on a geographic and demographic basis. They're overwhelmingly concentrated in working class communities, areas where working class people cannot work from home, cannot afford to take time off, potentially receive grossly inadequate welfare assistance and financial assistance if they're able to access it at all, which is increasingly not the case. Also in these working class areas, people often live in overcrowded and sometimes dilapidated and unsafe accommodation. So the map isn't very good on the right, but this is from a Victorian government website. It's showing the local government areas, so the sort of council-based areas of Melbourne. The darker the shading, the greater the number of cases. You can see the cases are overwhelmingly concentrated in the outer northern, western and southeastern suburbs. These are all very working class areas, very immigrant areas, lots of factory workers, manual workers. This is where cases are concentrated. You can see the lightest areas, hopefully you can see, sort of in the inner eastern suburbs of Melbourne, very few cases at all. And these are the wealthiest, among the wealthiest suburbs of Melbourne. In other words, this is a working class disease, a working class epidemic. Just to give some sense as to how significant this is, one of the shaded areas there you can see in the northern suburbs is the local government area of Hume. That includes suburbs like Broadmeadows, Craigieburn, Roxburgh Park. The city of Hume has now, per 100,000 people, has 922 cases per 100,000 people. Now that compares in the United States, taking the country as a whole, in the United States is 161 cases per 100,000. In other words, if you go to the city of Hume, if you go to the working class suburbs of northern Melbourne, you are nearly 6 times more likely to come into contact with COVID than if you went to the United States. Increasingly, working class people know at least one case, a friend, family, colleague. It's more and more the case that everybody knows somebody now who's contracted COVID. They did a suburb by suburb breakdown earlier this month in the Age newspaper. In some areas of the city of Hume, if you take the suburbs of Craigieburn, Mickleham and Roxburgh Park, a total of 1 in 40 people have the virus. Now, this is not a surprise what's happening. This was planned, this was predicted, as I said. The state Labor government commissioned epidemiological modelling for the Burnett Institute. The Burnett Institute said, well, if you open up in these conditions, you will have a 63% probability that the hospital system will effectively collapse. hospitalisation rate will exceed capacity, substantially exceed it. There'll be a 58% chance that intensive care units won't be able to cope with demand. The Billionaires Institute projected that up to 3,100 people will die. And this was all considered, accepted, and the state-governed Labor government just proceeded. In September, Labor Premier Daniel Andrews said that these figures from the Billionaires Institute were sobering, so-called, but that was the cost that had to be paid. He said, quote, "We cannot permanently suppress this virus. We've got to open this place up because remaining closed forever has its own cost." Now, I think that the destructive irrationality from a public health standpoint with this reopening drive finds its sharpest expression in the schools reopening. There is widespread confusion and anxiety and an element of shock about what's happening. I mean, I spoke to a colleague earlier this week and she pointed out that, well, it's a bit confusing because the schools were closed when daily case numbers were less than 10, and now daily case numbers are exceeding 2,000 and they're opening them up. And the schools are being opened up at a time when there are now just 7 weeks to go for the final term of the school year here in Melbourne. And after that, there'll be a 5 to 6 week summer break before school then resumes in 2022. But instead of maintaining online learning for the rest of the year and using the time gained to boost vaccination levels, make the necessary investments in schools to improve air quality and enact other safety mechanisms, the Labor government is deliberately placing at risk the health and safety of tens of thousands of unvaccinated children and their family members, including numerous people with immune-compromised health conditions. This school reopening drive is, of course, being driven not by health considerations, but by class considerations. The school reopening is a critical measure as far as the corporate elite is concerned. It's simply impossible to have every worker return to their workplace, which is a critical consideration that's now driving the junking of lockdown measures, without at the same time having schools open to take care of the children of the working class. Now, there have been numerous lies told about COVID and the impact on children, that somehow children don't contract COVID, or if they do, they don't spread it, or if they do, they don't contract dangerous health symptoms. All of these lies have been exposed through countless international studies into the impact of COVID. While fortunately children are less at risk of the elderly, nevertheless they are at risk, as is the entire population. Schools, where they've been reopened amidst community transmission, have proven to be vectors of the spread of the virus, and really horrific deaths have been reported now on the World Socialist website through different impacts of COVID in children. You can see here a list of on this slide, a list of the schools that are being affected. Hundreds closed, both in New South Wales and Victoria. These figures have been systematically suppressed. They are not reported in the media. They're not easily accessible through government websites. They are suppressed by the trade unions. And it has been the Committee for Public Education that has really alone promoted an awareness as to what's actually happening. You can see on the top slide there, it's a still image that we've circulated through social media, been very widely circulated amongst teachers and others. We've received thousands of people following the school closure updates that we're now releasing every day through social media. I'm mindful of the time, but I won't go through in any depth, the situation in the schools. I mean, it is a disaster, just very briefly. I mean, schools have been reopened. The government claims that it's ordered 50,000 air purifiers. Many schools, including mine, hasn't seen a single one of those. Even if that 50,000 were to be delivered, it would not cover each classroom. Kids under 12 are totally unvaccinated. Those over 12, a significant number, are not fully vaccinated, not double vaccinated. And you now have tens of thousands of people, hundreds of thousands of children and their families now crossing the city every day, public transport and so on. What's been revealed so far in the first 3 weeks of term 4 is just the beginning of what's going to be an accelerating pandemic. I do want to spend some time just detailing the role of the teacher unions, who, as I said before, have played a crucial role in enforcing this agenda. Throughout the pandemic, they have relayed government diktats, presented them to teachers as being unchallengeable, unquestionable. The teacher unions here in Victoria have actively worked to suppress any discussion on this issue. They've attempted to divert, COVID into an individual school's occupational health and safety question. In other words, there's no collective response permitted. It's up to each individual school, each individual group of teachers to work out their response to COVID outbreaks within their school. The union has actively suppressed discussion and opposition. Teacher members of the CFPE have been censored online, accused outrageously of disorderly conduct in union meetings, merely for raising the question about what is happening, what is the union doing about it, and what is the necessary measures to take forward in response to this pandemic. The union has claimed that it's a waste of time. That's a quote, a waste of time to report on COVID figures because they're involved in too many other important activities, including working out another sellout agreement on the industrial situation here in Victoria. But I think that overall, just to sum up, the role of the unions is, they are a bureaucratic apparatus functioning as an appendage of the government against the interests of teachers and school workers. And so this is why the Committee for Public Education has fought for an independent perspective, fought for the establishment of rank and file safety committees in every school, independent of the unions. We've issued multiple statements, the last major one on October 5, which I think you'll see in the slide there. Again, without going through all of those demands, you'll see we've got a very concrete list of issues and demands that teachers ought to be raising, can be raising through the framework of the rank and file committees within their schools. So I think that the development of this work is going to be all the more urgent going forward. We've, of course, developing the fight for school safety in Melbourne, Victoria, throughout Australia, not on some sort of local or national level, but rather as part of the international campaign that the World Socialist website and the International Committee of the Fourth International is spearheading. And we're very keen to develop further collaboration with our comrades in New Zealand and work together to oppose this really reckless rejection of elimination strategy and the promotion of a herd immunity type strategy that's going to lead to similar disasters in the Southern Hemisphere, as we've seen previously in the pandemic in Britain, the United States, and other Northern Hemisphere countries. So thank you very much for your time, everybody.
Thanks, Patrick. I think, that did give a very, I think, graphic sense of certainly the situation sharply in Victoria. But I think, as Patrick outlined, this is a phenomena which will inevitably and predictably spread through all the states of Australia. Our final speaker today is Comrade Tom Peters. Tom is in charge of the Socialist Equality Group in New Zealand. He writes extensively for the World Socialist website, particularly on the conditions of the New Zealand working class, on the struggles, the fight of New Zealand workers, the political situation in that country, as well as in the Pacific. Tom is actually widely known in New Zealand among workers and students. He undertook along with the other comrades there, a very detailed analysis and intervention into the fight of the Pike River workers, families, to ensure that the mine was not sealed and sealing all the evidence, as well as the bodies of the 26 miners who were killed more than 10 years ago. So I'm very, very pleased to introduce Tom Peters to deliver the last report.
Thank you, Cheryl, and thank you to Patrick and Harvey as well for your contributions. Jacinda Ardern's announcement on October the 4th that the government is, quote, transitioning away from its previous policy of eliminating COVID-19 came as a shock, I think it's fair to say, to scientists and to ordinary people all around the world. who had viewed New Zealand as a model for how to deal with the pandemic. This is what Ardern said. She said, long periods of heavy restrictions has not got us to 0 cases, but that is okay. Elimination was important because we didn't have vaccines. Now we do, so we can begin to change the way we do things, end quote. At the same press conference, she announced a further easing of restrictions in Auckland, with people now allowed to gather outside and to do more recreational activities. Any misunderstanding over Ardern's somewhat confusing statements should be cleared up by now because of what's unfolded since then. That the outbreak centred in Auckland has more than tripled in size, from 275 active cases to more than 1,000 now. There are cases in Northland, in Waikato, and just today there was a positive case reported in Blenheim, which is the first case in the South Island in I think about a year. This week there were 3 days of record daily case numbers, perhaps four days in fact, and the government recklessly announced on Wednesday that it will send thousands of high school students in the top 3 classes back to school next week in Auckland. This has sparked significant opposition from teachers, parents, and other school staff. The teachers' union, the Post-Primary Teachers Association, was forced to issue a statement saying that it was dismayed with the decision to return those students to school, but it has clarified that it would be happy to send the top level back. And in any case, this opposition is completely hollow, because the union has not announced any sort of strike action to stop the reopening from going ahead and endangering those thousands of students, teachers, and their families. It is collaborating, essentially, with this criminal and reckless policy. The Socialist Equality Group called this meeting today to discuss the political lessons that must be drawn from this rapidly developing situation and the urgent tasks that the working class now faces, both in New Zealand and internationally, in the fight to protect lives and to put an end to COVID-19. The Ardern government's former elimination policy has limited the number of coronavirus deaths in New Zealand to just 28 since the start of the pandemic. And leaving aside the problems and how the policy was implemented, the outcome speaks for itself. Elimination was and remains the only correct policy for defeating the pandemic. What might have happened without such a policy can be seen in a country like Ireland, for example, which has a similar population to New Zealand. There, the government opted for a series of totally inadequate mitigation measures, and as a result, Ireland has experienced a total of 5,369 deaths, and more than 18,000 people have been hospitalized, and more people are dying every day. In the past week, Ireland reported 63 deaths and more than 2,700 cases. By contrast, this graph shows the daily case numbers in New Zealand over the course of the pandemic. You can see the initial outbreak in March, April last year was successfully stamped out using one of the world's strictest lockdowns. And there have been a few smaller outbreaks since then that have also been eliminated. And the other cases that emerged among returned travellers from overseas. But the country was basically or largely free from coronavirus for at least for more than a year, until the current outbreak, which began in mid-August. And the response of the government was to initially lock down the whole country. In early September, that was lifted outside of Auckland, and then on September the 22nd, the government eased the lockdown in Auckland from the strictest level, level 4, down to level 3, against the advice of numerous experts. Hundreds of thousands of people were sent back to work as a result, including construction workers, fast food workers, and early childcare centres were partially reopened. Now, the Ardern government falsely claims the reason they did this was because the level 4 lockdown was no longer working, so it had to be ended. But as you can see in the graph very clearly here, it was working. The numbers were brought down and would have continued to fall, but they shot back up, not because of individuals disobeying the rules, but because of the government loosening the lockdown restrictions. As we have explained on the World Socialist website, this is a very deliberate policy. The ruling class opposes these hard lockdowns not because they don't work, but because they do work. These policies that have proven to protect lives are viewed as an intolerable burden on big business and a disruption to their profit making. So powerful interests have determined that New Zealand must no longer serve as an example for people all over the world, showing that the virus can be eliminated. The elite wants a different policy: reopen everything and let the virus spread, send children back to school so that parents can go back to work and corporations continue extracting profits from them. This is summed up by Boris Johnson, who's already been quoted, let the bodies pile high in their thousands. In the United States, the policy was exactly the same. The catch cry in the media was the cure can't be worse than the disease. There was an email sent by a Trump administration official to the Health and Human Services Assistant Secretary for Public Affairs in July the 4th last year, who said, infants, kids, teens, young people, young adults, middle-aged with no conditions, etc., have zero to little risk from the coronavirus. So we use them to develop herd immunity. We want them infected. That's a quote from this memo. So there's no middle ground between the elimination strategy and having COVID-19 spreading throughout the community, infecting people everywhere. And we can see that unfolding now in New Zealand, as well as so many other countries. Ardern is attempting to justify getting rid of the lockdown by saying that the population can rely now on vaccines, as that quote showed. This is important to clarify. Vaccinations alone cannot end community transmission of COVID-19, as the many examples internationally demonstrate. And indeed, as this slide shows, New Zealand's vaccination rate is still very low. Just 57% of the total population has had both doses of the Pfizer vaccine. In Britain and in Ireland, a much higher percentage are vaccinated, and there are still thousands of deaths and tens of thousands of cases. The following slides are from a presentation by a Canadian biologist and COVID-19 modeler, Dr. Malgorzata Gasperovic, who will be speaking in the webinar on Monday morning, New Zealand time. She produced this model to show it's mathematically impossible to solely rely on vaccinations to get rid of the Delta variant in particular. She, I believe, says it might have been barely possible with the original variant of COVID-19 to rely on vaccinations. Of course, we did not have vaccines when the pandemic erupted. But the Delta variant, which is twice as infectious, it makes it impossible. The first of those slides, as you can see, I'll just explain this. The R variant, which is the reproduction rate for the initial COVID-19 virus, was an R of 3, meaning it spread at a rate of one person passing it on to 3 people on average. The red line shows the effect that vaccines alone would have in reducing daily cases from a starting point of 100 cases per day. It would reduce the reproduction rate to 0.9, meaning that gradually, if you had a certain number of people vaccinated, 75% of the total population, you could bring down the number of cases and perhaps eventually eliminate the virus if it didn't mutate. What actually happened is represented by sorry, can you just go back a minute? The blue line there, thanks. This is what actually happened. There were public health measures, PH measures, namely the lockdowns that were implemented, which did reduce the reproduction rate. And I believe this graph is actually based on the New Zealand example, that is on a relatively strict lockdown such as we had in New Zealand, which succeeded in stamping out the first outbreak of COVID-19. And then the green line shows the combined effect of vaccines and lockdowns, what that could have been. It could have reduced the initial outbreak to 0 within 11 days. Next slide, please. But what happened instead is throughout the world, the coronavirus was allowed to spread and to mutate into the Delta variant, which, as you can see, is twice as infectious as the original one. And with this variant, it really becomes impossible to talk about just relying on vaccines. You must have a high vaccination rate on top of strict public health measures to eliminate the Delta variant. According to this model, you can do that from a starting point of 100 cases per day. If you imposed those lockdowns, you can reduce the number of cases per day to 0 in 28 days or a bit longer, according to this green line here. Next slide. This third graph, I won't dwell on this, but this shows what could happen if a much more infectious variant emerges. That's a real danger as long as the virus continues to spread throughout the world. As you can see, it could become resistant to vaccines or more resistant to vaccines, and therefore it might even be impossible to reduce the reproduction rate below 1 and to actually stamp out the outbreak. Now, the next slide shows modelling commissioned by the New Zealand government and released in September, which shows also the dangers of just relying on vaccines, and this includes relying on vaccines with moderate public health measures, including full testing, tracing, isolation, and quarantine. Under this scenario, with 80% of people aged over 12 fully vaccinated, there would still be in New Zealand 7,000 deaths per year and 58,000 hospitalizations, with 90% of the eligible population vaccinated. You would still expect to see 1,500 or so deaths. So the inescapable conclusion is the government, by what it's now doing, is knowingly risking thousands of people's health and their lives. it has ignored warnings from experts, including its own advisors, who have called for, who have criticised the drop in restrictions in Auckland and called for a level 4 lockdown and the elimination strategy to be reinstated urgently. One of these is the microbiologist Susie Wiles, who told The Guardian, quote, "Our change in strategy is not going to be felt the same by every New Zealander. Those who are wealthy and privileged are going to still live a wealthy and privileged life where they may not be touched, compared to other communities that may well end up being devastated by it." The epidemiologist Michael Baker, who will also be speaking in our upcoming webinar on the World Socialist website, we're very pleased to have him return again to speak. And he said of the reopening of schools, while cases were still rising on an exponential growth curve, "This is really simple. This is where every epidemiologist and disease modeler will agree 100%. Don't do it." We interviewed on the website Dr. Mike Bedford, who's New Zealand's foremost expert on early childhood centres, and particularly on public health in the early childcare setting. He tried to warn the government not to reopen childcare centres in Auckland at level 3, saying you categorically cannot operate safely in an environment with community transmission, and he was completely ignored. Another epidemiologist, Dr. Amanda Falsig, told the Science Media Centre on October the 12th, warned that Auckland was about to experience, quote, "a large and growing number of cases, hospitalisations and deaths, unless there's a move back to a level 4 lockdown." Doctors and nurses in hospitals have been expressing fears that there will be a tsunami of cases. The country has fewer than 200 fully staffed intensive care units for the entire country. And on a per capita basis, that is fewer than the UK and Australia, both of which are being overwhelmed by COVID-19. Most of these ICU beds, about 2/3, are currently occupied by people who need them for other reasons. So the crisis that is looming for hospitals is very severe. Dr. Falsig also said, quote, "Vaccination is not going to happen fast enough to reverse these trends." And she also said, which I think is important, "Before deciding on Aucklanders' behalf that they are too tired of lockdowns, let's hear from Aucklanders. Let's also hear from Maori, Pacific Islanders, people with underlying conditions, people who are marginalised, and children and their advocates." And this points to the really totally anti-democratic character of what the government is doing. According to the numerous surveys, somewhere between 70 and 90% of people supported the level 4 lockdown, and a similar proportion supports the elimination strategy. People can see what's happening around the world. They know that this strategy has prevented thousands of deaths. Both the government and the corporate media have promoted the myth that Aucklanders have somehow become fed up with lockdowns and are just not obeying the rules anymore. This is from the New York Times, when it reported on Ardern's announcement that they were ditching the elimination strategy. It seized upon this protest in Auckland by the extreme right-wing fundamentalist Destiny Church, which received a huge amount of media publicity in New Zealand. The Times didn't mention that this was organised by Destiny Church. It just characterised it as an anti-lockdown protest, and one that supposedly reflected the mood among many in Auckland, according to their coverage. In fact, it's one of the most, perhaps the most despised group in New Zealand. However, I mean, this is exactly the same methods that the US media used in the coverage of the anti-lockdown protests throughout the United States. They were provided with, virtually blanket media coverage, very small protests, most of them. But the idea was to give the impression that there was some sort of mass movement emerging opposed to lockdowns and demanding, quote unquote, freedom for the various states, as Donald Trump put it. Now the government has been challenged a few times, in fact, over why it is no longer listening to the experts in making its decision to not reimpose an alert level 4 lockdown in Auckland. This next slide shows what the Minister for COVID-19 response, Chris Hipkins, said when that was put to him on October the 13th. Perhaps we can just play that.
To rip off the system, if you like. Yeah, over here.
So some experts have said a circuit breaking level 4 lockdown may be needed to stop cases tracking up in Auckland as they are. What's your thinking on that, and could you rule it out?
That's not something the government is considering. Jane.
Can you say how many?
Why not? Why not?
Why not? Why not?
Why not?
Why not? Why not?
Why not?
Anyone else? The reality is, as I've already indicated, the alert level system that we have relies on a very high degree of voluntary compliance for New Zealanders. And what we've seen in those countries that have tried to sustain those kind of restrictions for a prolonged period of time, they have found that the effectiveness of those restrictions actually diminishes. So if you wanted to rewind back and say, had we stayed at alert level 4 this entire time, would we still be seeing an escalation in cases? There's a very good chance that we would still be in this position, because the level of compliance, the level of support for alert level 4 can still remain high, but it only requires the small minority who don't follow the rules to increase by a bit, and the effectiveness of those alert levels diminishes quite significantly. Jane.
So as you can see from that video, the government is actually struggling to justify what it's doing. All it really has to say is that, to blame ordinary people for refusing to comply with the restrictions, which is the same strategy being used in Australia as well to justify coming out of lockdowns there. The real reason, of course, that the government is not listening to the experts and has ditched its elimination strategy has nothing to do with whether it can be enforced or not. Let alone concerns about mental health or indeed workers' living standards. This is a capitalist government. The Labour Party and its allies, the Green Party, represent big business, and their aim is to guarantee, above all, the ruling elite's profits, regardless of the cost to public health and to people's lives. And the whole record of the government, in fact, since the pandemic began, demonstrates this fact. When Ardern announced one of the world's toughest nationwide lockdowns on March 23rd, 2020, during the first wave of the pandemic, that was done not out of some sort of benevolence of Ardern or anyone else in the government. It was out of the fear of an explosion in the working class. And this was not the government's first choice by any means. Just a few days earlier, Ardern had been telling the media that schools were not going to be shut down. And that was echoed, in fact, by the teachers' union, which declared that schools were safe places for kids, right up until the point when Ardern announced a lockdown, and despite all of the evidence that was already clear that schools internationally were a centre for the spread of the pandemic. What happened to change the government's position was a massive response to this petition started by Dr. Kelvin Ward, a Wellington physician, who gathered initially 2,200 signatures from medical specialists calling for an immediate lockdown. He gathered those in just a day or so, and he was backed by Professor Michael Baker and other experts. He pointed out that in Italy, at that point, there were more than 700 deaths being recorded in a single day, and warned that that could happen in New Zealand. And this prompted a massive response online. As you can see, this petition got more than 70,000 signatures just within a couple of days. And there was another petition also set up that received a similar number of signatures. So, you know, now what happened next is important as well. The trade union bureaucracy lashed out at this petition. Hilary Graham-Smith from the New Zealand Nurses Organisation complained to the News Hub media outlet that this petition was going to make people, quote, think the right decisions aren't being made. And then she said, we will have a state of panic. She urged people to trust that the government, quote, will make the right decisions at the right time. That reflects, in a nutshell, the role of the unions all throughout the pandemic in every single country. They have backed what the government has done to the hilt at every turn. The other really important aspect in the government's decision, they were watching the wave of wildcat strikes and walkouts that were erupting around the world, from Italy, from the UK, postal workers, Brazilian call center workers, and auto workers in the United States. This next slide shows the statement that our party, the Socialist Equality Party in the US, issued on March 14, 2020, shut down the auto industry to stop the spread of coronavirus, which was read over 130,000 times. And shortly after that, there were indeed mass walkouts across the auto industry and in defiance of the union bureaucracy. So the government in New Zealand acted out of fear that a similar movement involving tens of thousands of workers, led by healthcare workers and teachers, could erupt outside of the control of the trade unions. And that's what forced Ardern to implement a lockdown. Following that, the media sought to glorify Ardern internationally, giving her and her government all of the credit for how it handled the pandemic. There were at least 3 books published about Ardern last year, as you can see, all extremely praiseworthy. The Financial Times called Ardern a saint. The New York Times said she was a great leader, and the Atlantic magazine said she was the most effective leader on the planet. And the list goes on and on. I won't go through everything. But we warned on the World Socialist website, the reason for all of this was bound up with the real role that the Ardern government was actually playing. Like governments all throughout the world, it exploited the pandemic to hand over tens of billions of dollars to corporations in the form of subsidies, tax concessions, and bailouts. And James Shaw, the Green Party leader or co-leader and a member of the government, said last April, quote, our children and possibly our grandchildren are going to be paying back the debt that we are currently racking up to get through this crisis for many, many decades. Of course, he didn't literally mean his children or the children of the rich or the upper middle class. He meant generations of working people are going to pay for bailing out the rich, just as is the case in the US and Europe and everywhere else. In fact, living standards are already plummeting as a result of the government's austerity measures. In the year to June 2020, median incomes fell by more than 6%, driven by mass job losses and wage cuts. And since then, the government and big business have essentially frozen wages, which have continued to fall relative to inflation. The Reserve Bank's policies of quantitative easing have pumped tens of billions of dollars into the banks. Combined with ultra-low interest rates, this has created record profits for the banks and an ever-expanding housing bubble. The housing market in New Zealand is one of the least affordable anywhere in the world, and at least 2% of the population, more than 100,000 people, are essentially either severely housing deprived or homeless. 20% of children live in poverty, and charities in Auckland are reporting that the reliance on food banks has doubled during the recent lockdown. Poverty is being fueled by the wage cuts, job cuts, and totally inadequate government subsidies for small businesses. These policies are pushing thousands of people to fight back. The crisis of underfunding and understaffing in public hospitals led to a nationwide strike by 30,000 healthcare workers and nurses on June the 9th. Outside Parliament, thousands of these workers erupted in anger and essentially booed the Health Minister, Andrew Little, off the stage. Internationally, we've characterized the pandemic as a trigger event in world history, comparable to the First World War. That is to say, all of the tendencies in society which have been building up for many decades have been accelerated by the pandemic. The growth of social inequality, the ruling classes, move towards dictatorial measures and militarism, but also on the other side, the radicalization of the working class. Worldwide, an estimated 15 million people have died from this virus. In the United States, more than 140,000 children have lost a parent to COVID-19. These are horrific events being repeated in every part of the world, which are unseen outside of wartime. And this is having a profound impact on political thinking and is fueling opposition to capitalism among workers and young people. Millions of people are coming to understand that the ruling elites view their lives as completely expendable. And that is no different in New Zealand. When Ardern and Labour were re-elected last year, there was again a wave of glorification by the media, as well as pseudo-left organisations, which claimed that this was a government, this was a left-wing government. I don't have much to go. I will try and be brief. But what has happened is that this government has lurched ever more sharply to the right with the full support of the trade unions, and that is what is signified by the reopening of Auckland, the adoption of the same herd immunity policies that have been implemented throughout the world. The Labour government is aligning itself with the most right-wing forces. Not only, it's no accident that Jacinda Ardern made her announcement just 2 days after the Destiny Church rally, and only a few days after an announcement by Prime Minister John Key. The slides are a bit behind. Yep. The multi-millionaire chairman of ANZ Bank, who demanded an end to lockdowns in September and compared New Zealand to North Korea. This was reprinted all throughout the media. Various pundits in the media are now regularly attacking scientists. This is an international development. These are just a couple of examples of Stuff's political editor, Luke Malpass, has repeatedly demanded that the government stop listening to epidemiologists and consider what he refers to as other factors, which means the needs of big business. This is a recent column by Bill Ralston in the Listener magazine suggesting that epidemiologists should be locked up. because they're spreading fear and panic. I mean, as with climate change, the defenders of capitalism are attacking science, the science of the pandemic, because the prescriptions of the epidemiologists interfere with their ability to make profits. The working class, we say, must come to the defense of science. Only the working class has an interest in ensuring that this pandemic is dealt with on the basis of human need, with no expense spared to save lives. Under capitalism, every scientific advance is distorted. Vaccines, for example, are being hoarded by wealthy countries and sold by rival companies to make money, so that only 37% of the global population is fully vaccinated. Science must be freed from its capitalist chains so that it can be used as the powerful tool for ending social inequality and disease and for mitigating natural disasters. That is why the World Socialist website is providing a platform to some of the most principled scientists from around the world to discuss how to eliminate COVID-19. Just to conclude, what must workers do in the face of this? Well, first and foremost, workers need to arm themselves with scientific knowledge about the pandemic so that they can combat the confusion and lies being spread by the media and politicians. At the same time, workers have to organise themselves to fight against the unsafe, homicidal reopening of schools and work sites. There is very little time as the pandemic spreads out of control. In April last year, we published the perspective Forward to the International Workers' Alliance of Rank and File Committees, where we said, for the working class to fight back, a path must be created to coordinate its struggles in different factories, industries and countries in opposition to the ruling class and corporatist unions. The IWA RFC will work to develop the framework for new forms of independent, democratic and militant rank and file organisations in factories, schools and workplaces on an international scale. The working class is ready to fight, but it is shackled by reactionary bureaucratic organisations that suppress every expression of resistance. The example, I think, of the parents' strike in the UK shows the way forward. This had to be carried out independently of the Labour Party and the trade unions, which opposed it and which support the homicidal policies of the Johnson government. Workers in New Zealand face the same essential task in the fight against the Ardern government's increasingly reckless rush to reopen and to allow the virus to spread everywhere. Above all, a new political leadership is needed for the struggle ahead. As we said in April, action is required, but serious action must be based on program and principles. Sustaining and developing a network of independent organisations requires the development of a socialist leadership in the working class. The fight to end the pandemic and to save millions of lives is a revolutionary question. It requires a break from Labour, from every other parliamentary party, and along with the unions. I therefore urge everyone here, if you're not already a member, to join the International Committee of the Fourth International and in New Zealand to turn the Socialist Equality Group into its New Zealand section. Thank you for your patience, and I welcome any questions.
Thanks very much, Tom. Look, there's been such a plethora of information, of analysis that our three speakers have provided. We do want to open for questions, comments that listeners want to place in the chat. We have got two, one which I will just answer. Will this recording be accessible from the meeting? Yes, it will. We'll post it either on Facebook or somewhere else that's accessible. We normally do. We may post it on the World Socialist website, but it will be accessible. And then there's another question from Matt, who asks, what do you think about the Maori Party calling the Labour reopening policies modern genocide? But if there are any other questions, any at all, certainly about the situation. I mean, you have 3 countries, 2 continents that you can ask about. New Zealand, Australia, and the UK. This is your chance. So if there's any questions at all, please feel free to ask. We have insisted that Harvey remain up, so he won't go, he hasn't gone back to bed, he's here. So if you want to ask any questions of Harvey about the situation in the UK, of the the school strike, please feel free. But I propose, Tom, you deal with the Maori Party question.
Yes, certainly. I mean, you know, we've certainly agreed that the response of the ruling class to the pandemic is essentially a crime against humanity. I mean, whether one uses the term genocide, however, I don't know. But I think the issue with the Maori Party, it raises a number of questions. I mean, Maori make up about 15% of New Zealand's population, but they are definitely overrepresented in this current outbreak of coronavirus, of the Delta variant. They are, let me see, 770 cases out of about 2,500. So I guess that's roughly a third of cases. And that's because this is the one of the most oppressed sections of the working class in New Zealand. They also have a lower vaccination rate. I think it's lagging about 10 percentage points behind the general population. It's, you know, I think, however, the attempt, what the Maori Party is seeking to do is to frame this entirely in terms of race, you know, as a racial question. The Pākehā or white society carrying out genocide against Maori. That is certainly not not accurate. This affects working people of every ethnicity: Pacific Islanders, European, Asian. If this is allowed to spread, it will kill people from all of those groups. So we don't agree with the Maori Party on that. And I mean, what's behind this position, I think, is an attempt to really divert growing anger in the working class into a kind of racialist channel, rather than what we fight for is to unite workers of every ethnicity. The Maori Party is a capitalist party. They were in a coalition with the National Party from 2008 to 2017, which oversaw major attacks on the working class, including Maori. They privatized power companies, they increased the goods and services tax, and oversaw mass redundancies and other such policies in response to the global financial crisis. So this is a right-wing party, which certainly has no concern about the working class, Maori or non-Maori. What it's worried about is the real prospect of a unified movement of the working class emerging, and it is seeking to derail that by making the deaths from coronavirus into a question of purely a kind of racial issue.
Thanks, Tom. There's another question for Harvey. What has been the response of parents and teachers to the school strike, and what has been the response of the unions?
Okay, thank you for that question. Yeah, I just start with the question of the unions first, if I may. I mean, they've done, as a sort of point out, you know, the teaching unions in particular have done everything they can to facilitate really the full reopening of the schools within, amidst the pandemic, and to really castigate parents who are wanting to fight back, and teaching staff, and just in the, a case of trying to bolt the door after the horse is bolted, after the horse is left. Really, there's two articles from the Guardian yesterday which really exemplify the really cowardly and disingenuous nature of everything that they put out as statements on the pandemic. There was an article yesterday in the Guardian newspaper, which I should just point out, as a newspaper, has just functioned as a mouthpiece of the labour and trade union bureaucracy throughout. An article yesterday appeared saying, basically making great play of the fact that the unions are now warning, of a real, what they call a winter of chaos, if urgent action isn't taken to curb the virus. Obviously, all actions previously and in the future, there's nothing to suggest that the unions will not actually work hand in glove with the government, to actually prioritize economic interests over those of the lives of the workers. But there's a whole list of trade union leaders appearing, really in response to what they know, as a real danger. They're very conscious of this, and the real danger of a movement emerging out of their control amongst the workers to oppose this. I mean, there's a so-called Plan B, which has been proposed, but the government has no intention of putting into place. There's a survey that was conducted where 90% of head teachers said that their school had been affected up to the case of severely, even more so than in any previous part of the pandemic. And this is obviously in a situation, as we've reviewed here in this webinar, where there's been a vaccination program run. So that's been the response of the unions, really. But what's been the response of I think the first part of the question is, what's been the response of parents? I mean, the response of parents increasingly, I think, is, obviously of concern, as they can see, there is no constituency amongst any of the political parties, the unions, any of them, to safeguard their children, themselves, their families, and to let this virus really continue. And I think, obviously, as we've reviewed the initiative of Lisa Diaz, it's not an individual question, but it expresses, what many parents, educators, school staff will have been feeling and thinking, and are consciously now trying to put into place. And that is why I think the call of the party is attracting wider layers. They're still facing the increased pressure. The pressure itself is accelerating for somehow or other there may be another point in the future where there will be no virus, or these mitigation measures, or whatever cosmetic thing they throw at it may have some kind of effect. But as everyone on this webinar said, the trend amongst the ruling elite worldwide is in the opposite direction, and the working class is moving in the direction towards resolving this. I'll just say that. Thanks.
Harvey, there's a related question to that, in which the question is asked, are you able to gain at this stage how many parents took part in the school strikes and let their children home, or I suppose kept their children home school by school, or is this being suppressed by the bourgeois press?
Yeah, well, I mean, that question has most succinctly been answered by the final part of it. It has been suppressed. I mean, from the very beginning of the pandemic, the most salient aspect, the most important aspect of the actual deaths of school staff and then children was being suppressed. All information, the most important information, has been suppressed. And sometimes you've got local reports on certain aspects, but that's nowhere near the level that it needs to actually meet up or anything approaching what the World Socialist website has done, and actually taken an international perspective and highlighted the significance of all of these cases in totality. And so for that reason, it's very, very difficult really to ascertain the full quantified results of the school strike, but it is known nonetheless that it did have an international impact. We're far beyond just the schools, as important as it is. It's just in the UK, and for that reason, I think that explains why the suppression was so important on the behalf of the bourgeois media and press.
Yes, exactly. I mean, and there is another question for you and then one for Tom. Can you review, thank you, Harvey, thank you for your contribution. Can you review the government action that is being used against parents who fear sending their children to schools that are the centres of COVID infection? Did you get that?
Yeah. I think there's lots of different elements to that, but thanks for that question. I mean, as you know, there's a new education secretary, Zahawi, surname, and he's come in, as like I suppose the government presumably is like a new broom, and things are back to normal. Supposedly the schools are open, and so why would there be this issue with attendance? Yes, as the narrative would go, we are aware there are cases and all the rest of it, but really need to buckle down now. I mean, that is the message really, and the implications of that is all of the old, the former pre-pandemic legislation and measures has been ramped up and thrown at parents, from what would be nominally fines, fixed penalty notices they're called, and when they're not paid, they actually increase the double, which is just on the face of it is very, very, as you can imagine, onerous on parents. Maybe if for example, if a family has 2 or 3 children in a school, they each receive a fine. They would each receive a fine, and that would increase if not paid in a certain fixed period. And then now there's the questions of actually more serious, the case of jailing, and what's been mooted of child safeguarding measures being enacted. This is all, quite consciously being used. All of this is quite consciously being used to send a message. I think that's important to note. The numbers of parents that they may try and catch in this net has to be magnified to the millions really who are being told by these measures that you should think very carefully before you oppose what we are trying to do. And I think that really speaks to the heart of what we're trying to do here in the whole international strategy that we've taken to end the pandemic. I mean, the ingredients, if you like, to end this pandemic are what we've highlighted here, and also large amounts of courage with that, and an ability to stand up to this pressure, which can only really be based on a program, a perspective, which goes far wider, obviously, than schools, localities, regions, and nations. It has to be international. The commonality of all of the experiences I've just reviewed here show that this is not just a question in the UK or Europe, it's an international one. So I hope that answers that. Thanks.
Yeah, are there any figures on the number of parents that have been fined? Has that been released anywhere?
I'm not aware of any figures. That's something that I think which probably is a moving target in that sense, because in this process there always lags behind, obviously, the notification, if you like, of fines and such like. So that'd be important to actually gather that information in the coming period, as this term has now come to an end just of yesterday.
Right. Yeah. Okay. All right. Thanks. Okay. There's another question, and it's for Tom. How have other socialist organisations in New Zealand responded to Ardern's decision to abandon the elimination strategy? Have they supported her government or the epidemiologists?
Right. Well, it's a good question. I guess, what we have identified as pseudo-left organisations, because that's what they are. There are certainly no other socialist organisations here or outside of the International Committee. I think it's no exaggeration to say we are the only organisation that has consistently warned the working class, that this is a right-wing government and that they could place no confidence in it at all. I don't know if we can bring up the slide, which we may have gone through rather quickly, showing the response of these groups to the election last year. But in essence, they have encouraged illusions in the government since 2017, when it was first elected, and they continue to do so. The ISO, in its response, the International Socialist Organisation, to the government abandoning its elimination strategy, I mean, they criticise it, as indeed the Maori Party has, and the Green Party as well have issued, at least in words, they've criticised it. The Green Party still being part of the government at the same time. But they criticise the government from the standpoint that they are basically offering it advice. So in an article on the ISO's website on the 8th of October, they say, the Ardern government must not be allowed to hide behind an emphasis on vaccination to justify watering down the elimination aim to only suppression of Delta. It must reverse the loosening of restrictions, which the virus will surely exploit. There must be an intensive socially equitable vaccination campaign and widespread vaccine mandates. Vaccination must be set very high, etc., etc. And so they also say, the New Zealand government's reaction to the pandemic has been far from perfect, but we have always given credit where credit's due for the elimination strategy and aligned ourselves with the government's public health approach. However, we always knew the Labour government was fundamentally pro-business capitalist government. That they have caved is shocking, but not a complete shock. What they are not doing is calling on the working class to take any sort of action. It is, an appeal to the Labour government, basically, to go back and to a stricter lockdown and to its elimination strategy. It's a completely bankrupt perspective that the government is showing in everything that it does. It is moving in exactly the opposite direction. Yeah, I hope that answers your question. I mean, it is an important question.
Well, I think we'll have to assume that you have. Look, there's a comment in the chat at the moment, which I'll read out, and then I will just refer to the literature, and if any of the speakers want to make a comment about it, then please feel free. We, if I may, speak of the pandemic as a trigger event comparable to the assassination of Ferdinand. I think it's critical to further draw parallels to World War II, in that the preponderance of anti-lockdown propaganda and demonstrations pivot upon the plight of the petty bourgeoisie, particularly those lower elements closest to the proletariat, and warn that the petty bourgeoisie is not homogeneous, nor are the measures purportedly taken in the interests of the lower layers in closest proximity to the proletariat. These are bourgeois pursuits demagogically appealing to proletarians, proximate to lower petty bourgeois, and these really diverging interests cannot be confused. And then there's another question for Tom. You mentioned the strike of New Zealand nurses in June this year, but has there been any more proposed strike action by nurses or health workers generally, or any indication of health workers' opposition to government's reversal, especially given the low numbers of ICU beds over the country? So look, I will just draw participants' attention to the literature that we have for sale, or at least some of the literature that we have for sale. As the slide outlines, we have the New York Times 1619 project and the racialist falsification of history. This has been produced just recently, in fact, only in the last few months, and it is a compilation of essays by David North and Thomas Mackerman, and it is in response to the New York Times 1619 project, which was launched in August 2019, in which its role was to completely rewrite history, to transform the revolutionary character of the American Revolution and the Civil War to a racialist narrative, that the history of the United States, the central driving force was really race, was the fight against Black Americans, against their white brothers and sisters, which of course is a profound rewriting of history. And as we know, the rewriting of history always has a contemporary purpose, and that is the promotion of racialist narrative, of the division of the working class along racial and ethnic lines, in order to ensure that the unification of the working class against the program and the political perspective of capitalism does not take a socialist direction. And so I think that it is a very important text in which the discussions that were held with the historians such as James McPherson, Victoria Bynum, James Oakes, Richard Carwadine, and others referred to and dealt with. And these historians turned to the International Committee, to the World Socialist website, because it was only the World Socialist website that fought against this complete redefinition of the history of the American revolutions. So it's available and it's $35 plus postage. And also we have the Russian Revolution and the unfinished 20th century. And this is also a number of lectures and articles and essays written by Comrade David North, who was the editor of the international, chairman of the international editorial board of the World Socialist website. And what it refers to, what the unfinished 20th century refers to, is the fact that not obviously that the 20th century has not ended as a chronological entity, and that we're not in the 21st century. Obviously we are, but it refers to the fact that the all the unresolved political and social issues of the 20th century have themselves been unresolved. And of course, the historians generally agree that the 20th century began on August the 4th, 1914, with the outbreak of World War I. All those issues which led to that bloody conflagration, the most barbaric, bloodthirsty event of mankind to that date. All of those issues, which of course then led to the Depression, the Second World War, and the continuing wars over more than 25 years since. And so this deals with the relationship of the Russian Revolution, which, as I referred to, was the event which culminated, which drove the ruling classes, the warring nations within World War I to negotiate for peace, not because they were concerned with the death toll, but because they were concerned that the same events which took place in Russia would in fact take place in Germany, Britain, and of course the other European countries. So this is an extraordinarily important text and very accessible, and explains that relationship. It is $30 plus postage, and then of course there is the Socialist Equality Party Statement of Principles, which is the condensation of the historical, political, principled basis of membership of the Socialist Equality Party. Agreement with that, and you know, to a degree, an understanding of that book, because in order to agree you have to understand it, is the basis for membership of the Socialist Equality Party in Australia and of the SEG in New Zealand. It's $5 again plus postage. So I would certainly urge anyone who does not have these texts to purchase them and begin a study of these important books. But if there's anybody who wants to comment, answer, or Tom can answer Kate's question on the New Zealand nurses. There's another question: how workers can mount a campaign against the historic legislation, ECA 1991 and ERA 2000, that make it illegal for New Zealand nurses, teachers, etc., to strike freely in situations like this pandemic. Should workers take wildcat strikes? So there's those 3 points, which if anybody wants to comment on the issue of the trigger event and the relationship of issues between World War I and World War II, or the questions of the New Zealand nurses, then please feel free to do so.
Well, I'll just jump in. The nurses were in fact scheduled to have 2 more strikes when the lockdown was announced in mid-August, those strikes were then cancelled. And just recently, in fact, I think a week or 2 weeks ago, the New Zealand Nurses Organisation basically, held a vote and basically pushed through the sell-out agreement that essentially freezes wages and has, that's now been passed. So in other words, the union made use of the lockdown and the pandemic crisis to cancel its industrial action that workers had voted for and to pass this deal, which does nothing also to improve staffing in hospitals, which is a major concern of nurses and other healthcare workers. So nothing has been done to resolve the crisis in hospitals, and I think it is only a matter of time before this erupts in some form among healthcare workers. The other question about the legislation, I mean, yes, this is essentially anti-strike legislation that prohibits industrial action outside of very narrowly defined circumstances that the unions fully support and indeed helped to write this legislation in the 2000s under the Helen Clark government. It does constrain workers all over, in every industry, and not just the ones that you mentioned there. And yes, the problem workers face is to be able to act outside of the extremely restrictive, basically police type organizations that the unions are. They need to come up with new forms of organization. I mean, that's the key. And yes, we are certainly in favor and we of workers organizing outside of the unions and carrying out industrial action through that method. Yeah, I mean, I've only answered that very briefly. Can certainly elaborate, but
we don't actually have a huge amount of time, unfortunately, but is there any other comments? Any of the speakers want to answer anything else or deal with any of the points that have been made? I mean, I think the point that it was Ross who raised about the petty bourgeoisie is not homogeneous, and that there is a concentration in that sense in the anti-lockdown demonstrations and anti-vaccination demonstrations about the plight of the petty bourgeoisie. I mean, that certainly, there is certainly a preponderance of concern about business, but I mean, I think also I think it would be wrong to think that all, and I'm not suggesting that Ross is raising this at all, but the small businesses who have been, I mean, completely devastated by the situation which the governments have created with the pandemic. I mean, the attitude of a socialist government would be that the necessary lockdowns, the necessary closures of non-essential factories, businesses, production, would be, that those small businesses would be compensated just as workers need to be compensated. They need to be ensured that they are able to pay the bills and all the associated issues that arise with a small business. I mean, because in that sense, the petty bourgeoisie will go and will support either the working class or it will support the ruling class. And the political nature, the political character of these anti-lockdown demonstrations is dovetailing entirely with the political perspective of, certainly in the United States with Trump, with, you know, increasingly fascistic layers whose aim is the smashing of the working class and the smashing of the organisations of the working class. These are profoundly nationalist, anti-proletarian demonstrations and formations and layers. And increasingly, one can see very little divergence between the positions of the unions and the unions' demands that workers work 16-hour days, they work in Dickensian conditions, and you know, that they attempt to pit the American working class, the Australian working class against their class brothers and sisters internationally. I mean, there is a very close relationship between the political perspective of the unions and that of these right-wing, extreme right-wing and fascistic layers. But of course, the nature in that sense of the petty bourgeoisie is that it is increasingly being proletarianized, being driven into the proletariat. And of course, the working class internationally is of a scope and growth and size, which expresses its incredibly powerful, in fact, most powerful position that it has been in really for generations, if ever. The globalization of production itself is creating an internationalization of the working class and of their struggles, as we, and quite frankly, we alone, have fought to draw out and identify and develop. So I think the points that Ross raises, you know, are important, and of course the necessity, the winning of the proletariat, the winning of the petty bourgeoisie and those most advanced layers, those most class conscious and progressive layers, will be bound up with the perspective of winning of the working class to a socialist perspective, that there is a program which the working class puts forward in winning the petty bourgeoisie. But look, I think we are going to have to, you know, draw our meeting to a conclusion, which is a pity because I'm sure there would have been other discussion that we could have held. I will just very quickly appeal to all those in attendance to donate to the New Zealand SEG. Of course, as is the case in every section, the resources, the funds are sourced wholly and solely from the working class. New Zealand, the SEG in New Zealand, its only form of finance is from its members and from the supporters within the working class and the professional layers who are attracted to a socialist perspective. I would urge you very, very stridently to generously donate to the where is it? The email, is it? Is that what people do, Tom?
Yes, please either email us or we do have our account there if you want to simply
is that the 03 number,
that.
is it?
Yeah.
Oh, okay.
Yeah, or send us an email and we can arrange it.
All right. Okay, fine. So while everybody's doing that, and if you could just put in your how much you're donating in the chat, so we can give a running total, that would be greatly appreciated. As all the other speakers have highlighted, we again urge you to attend the October 24-25 for our neck of the woods public meeting, which is on October the 25th. In Australia, it's 4 a.m. It's in New Zealand, it's 6 a.m. On the 25th. It will be, I think, an extraordinarily informative, educational meeting in which questions will be fielded by the epidemiologists, by our comrades, by workers who are engaged in this struggle. And the reason that we are holding this is because workers have the right to the truth. They have the right to know the science of the pandemic that has so transformed the lives of virtually everybody on earth. This, you know, and this information, this knowledge is not available through the bourgeois press. It is not available in the universities. It is not available anywhere other than through the pages of the World Socialist website, and of course through these events. So I very, very strongly urge you to attend. Also, we have a lot on. On October the 31st, the Australian SEP is holding a public meeting in regards to the electoral laws. Sorry, I've just lost my page. A socialist program to eliminate COVID-19. Become an electoral member of the SEP today. We are, you know, in the last month of the campaign, and we will be holding, as we intend to do each month of the campaign, a public meeting in order to discuss the source of this profoundly anti-democratic attack upon the minor parties, but more importantly on the rights of the working class to vote for the party of their choosing. I'm not sure if there's a slide for that, but anyway, it will be on, I think it's at 1 o'clock, but we also very much urge you to attend that meeting. Hang on, sorry, no slide for that. Okay, and finally, I think and what is most important is, if you are an Australian citizen and you're not an electoral member, we urge you to join, to sign up. Anybody who is an Australian citizen, others are not eligible to join, because you have to be eligible to be enrolled on the Australian electoral roll. You can be 16 or 17, although you can't vote. You can enroll, and that's the criteria for the Australian Electoral Commission. These are not our stipulations, but if you are 16 or 17, you can enroll, and you need to enroll, and then you can join as an electoral member. But also, I think everybody, those from New Zealand, those from Australia, from any other country, if you are not a member of the Socialist Equality Party, of either or any of the sections represented here today, then we very, very greatly urge you to think seriously about joining. Without a party, without a revolutionary leadership, the working class, no matter how courageous, how widespread, how determined, will not be able to overthrow the system which is now threatening the very existence of mankind through the pandemic, through climate change, and of course through the drive to war. This is a period like no other, and it requires a political perspective which is based upon internationalism, the development of a socialist perspective, and of course the fight for the overthrow of capitalism. And so we urge you, if you agree with that perspective and that program, to contact us, to apply to join, and it will be the most important decision that you will make, and one that will have a profound impact on the entire development of history and of course the fight for mankind as a whole. So I thank you very much for your attendance, for your participation. I very much want to thank our speakers, particularly Harvey Thompson from the United Kingdom, Patrick and Tom, and we will see you hopefully in a couple of days at the October 25 meeting, and then at our other meetings. And of course, contact us if you want to join. Thank you very much for your attendance.